Hello everyone. Today I would like to discuss you regarding healthcare agencies. So firstly we will discuss regarding WHO. Coming to this WHO, it is known as World Health Organization. So everybody is familiar with this WHO, and nowadays we are hearing about this organization mostly. So since the pandemic which is going on here, everybody are focusing on the WHO. Why? Because it was the World Health Organization. All the countries are included in this WHO, and all the guidelines which has to be followed in the field of health and in the field of communicable diseases, mainly these guidelines are coming from the WHO. So here, what is the WHO, where it is located, and what are all the roles and what are all the activities, what is its structure, we are going to discuss in detail. So coming to this WHO, it was a special non-political agency. Mainly it is developed by the United Nations, and it was established in the year 1946. So if you see the headquarters, they were located at the Geneva. So mainly this constitution, it came into force in the year 1948 in the 7th April. Though it was established in the year 1946, it came into force in the year 1948 7th April. So coming to the objectives here, mainly the main objective of the WHO is to provide highest attainment of health to all the people over all the countries. So it is focusing on the entire globe, not to a particular country. The main aim is to provide health for all, means highest standards of health for all. Coming to the other objectives, mainly when a person is said to be healthy, he is to be completely in a complete state of physical, mental, social and spiritual aspects. So the first objective is to provide people the complete state of physical, mental and social well-being, and no discrimination should be shown in the path of attainment of highest standard of health. This is the second objective. And the third objective is good health is for attainment of peace and security. So whenever there is good health, there will be peace and there will be security. And good health, it is valued to every person, it is valued to all. And next one is equal development and promotion of control of diseases in all the countries. It is not that this World Health Assembly should not permeable to one country, it should be elongated to all the countries, means all the countries in the world should participate. Every country should participate in the promotion and control of the disease as well as the development. Next one is extension of people benefits in the field of medicine, psychological and related to knowledge base, and we have to inform, we have to take the opinion they have. And next one is active cooperation. So all these are all the objectives which were in the WHO. Coming to the membership in the WHO, see how a country can join the WHO, means it is open to all the countries. So most of the members are from the United Nations and the WHO. If you see the territories which are not responsible for the conduct of their relations may be admitted to associate members, and associate members participate without vote in the deliberations of WHO. See, if you see here, as it is open to all countries, if some nations are not providing, but these members they can participate there, but they are not having vote to elect a particular person, means vote to elect a director general. So if all the countries who are having membership, these countries are allowed to vote in the WHO in order to elect a director general. But even though it is open to all countries, if any country is not taking participation, means it is, if any country is not in this associate, and they can come, they can sit, but they cannot vote. Next one is each member contributes yearly to the budget, and each is entitled to the services and aid of the organization which can provide. If you see here, all the membership, all the members who are present in the WHO, they should contribute to the budget every year, and the budget which had been contributed, it will be used for the services which are provided by the WHO and this organization which can provide, and it will help the organization to run successfully. Coming to the work of the WHO, so what is the work of WHO here? Mainly preventing the prevention and control of specific diseases, development of comprehensive services, family health, environmental health, health statistics, biomedical research, health literature and information, cooperation with other institutions. So all these are the works which were done by the WHO. Coming to the structure here, so World Health Assembly, what is the structure? It has a World Health Assembly, it has a executive board, and it has a secretariat. So what is this World Health Assembly? So it is the supreme governing body and the health parliament of the all nations. So every year a meeting is held at the headquarters Geneva. It mainly composed of different delegates which are representing different countries, and the countries which are having membership in WHO, these persons are having vote to elect a director in general. Coming to the functions, so the function is international health and policy programs, and reviewing the work in the past year, and approving the budget for the current year, and approve the budget which is needed for the following year, and they will elect the member states to designate a person to serve for 3 years. If you see here, whenever an old person is retiring, a new person has to occupy the seat here. So it is the duty of this World Health Assembly to elect a person, to elect the main person, and to run the institution successfully. Coming to the next one, executive board. So this executive board, it consists of 18 members, and these are incremented to 31 members by World Health Assembly. So members, a person who is member in the executive board, he should be qualified in the field of health, and these are designated by their respective government. So if you see here, every year 1/3 of the members are replaced and 1/3 of the members are renewed. So if you see this executive board, it meets every year in the month of January and May after the meeting of the World Health Assembly. They will meet in the month of January, and after the World Health Assembly has met in the month of May, again they will meet. So the main work of the board is to give decisions and policies to the assembly. And next one is emergent and immediate actions in case of epidemics and earthquakes. So if there is any kind of immediate earthquakes or immediate epidemics which are occurring, which is an emergency state, during that state the action will be taken by this executive board. Next one is the secretariat. So what is the secretariat? It is mainly headed by the director in general. So the main aim is to provide the state members with technical as well as managerial support for their national development program. So what are all the national developmental programs which were implemented in the countries, in different types of countries, these will be monitored by this secretariat, and they will give them the technical support, they will give them the managerial support, and they will give even some kind of funding also. So if you see here, as the director general, as it was headed by the director general, there are 5 assistant director generals, and each person is taking one different tasks here. So coming to the divisions, so there are lot of several divisions which were in the director of secretariat. So the divisions goes like this. The first division is epidemiological surveillance and health situation and trend adjustment. So this division is responsible for epidemiological surveillance. So what are all the epidemiological diseases which are going in, what is the current situation of health, and what is the current trend, and they have to get adjusted according to the current trend. Next one is division of communicable diseases. So it is mainly focusing on the communicable diseases. Next one is vector biology and control, how to control the vector-borne diseases. Next one is division of environmental health, division of public information and education, and health division of public information for health, division of mental health, mainly focusing on the psychological aspects, division of diagnostic and therapeutic and rehabilitative technology, it is mainly focusing on the diagnostic technology, it is mainly focusing on the newer treatments, and what are all the rehabilitative aspects which were available, and division of strengthening the health services. So what are all the health services which are being provided, it will be monitored by this assembly. So what they will do, they will give us suggestions, and they will help us, they will give us some points to strengthen the health services. Next one is division of family health, which is mainly focusing on the health of the families, and division of non-communicable diseases, which were. Next one is division of health and manpower development, division of information system support, division of personal and general services, and division of budget and finance. So all these are the different types of divisions which were present in the secretariat. Coming to the regional centers here. So what are all the regional centers means? As I said, there are several countries which were participating. If you come to Southeast Asian countries, here the regional office is present in the Delhi, India. If you go to African countries, it was located in the Harare, which is in Zimbabwe. And if you come to America, it was located in the Washington DC, USA. If you come to the European countries, it was located in the Copenhagen, which is located in Denmark. And if you go to the Western Pacific, Manalia, it was located in Philippines. So these are all the WHO regional centers which were located in different countries. Coming to the regional officers, so these regional officers, these are headed by the regional director. So they get assisted by the technical and administrative officers, which are the and also the members of secretariat. So these regional officers, even though they are headed by the regional director, the technical and administrative officers and the members of the secretariat, these members will assist these regional officers. So it will be composed of representative of member states in the region. So who are all the persons who are representing the different states? There will be present in these regional offices. So these regional committees, they meet every once in a year. And what are all the regional plans that had been made? They will be mainly focused by the Director of General of the WHO. Coming to the Southeast Asia region countries, that is zero located countries, we have Bangladesh, we have Bhutan, India, Indonesia, Korea, Maldives, Myanmar, Nepal, Sri Lanka and Thailand. All these are the countries which were in Southeast Asia region. Coming to the activities of the zero. So what are all the activities here? Malarial eradication, tuberculosis control, control of communicable diseases, health laboratory services and communicable diseases, health statistics, maternal child health, nursing, health education, nutrition, mental health, dental health, medical rehabilitation, quality control of drugs and medical education. So all these are the activities which are carried out by this Southeast Asian region organization. So this is WHO. In brief, I have said. If you have any queries, please drop it down in the comments. Thanks for watching. If you like the content, please like, share and subscribe the channel. Thank you so much.